growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I'm Dr. Steve Rasner. You're tuned into The Lionhearted Dentist. Let me be one of the first to wish you a very happy New Year. And let this be the breakout year for your practice. Use me to make this the breakout year for your practice. I want you to write me an email sometime this year that this was the changing point, motivation that you needed. I want to play a role in that for you. That's my goal. So, having said that, a couple housekeeping items. Yes, I always told you I don't have an agenda with these podcasts. Maybe I do have an agenda. I want to meet you. So a couple things. I said at the end of the last few, write to me if you have any interest in having a live event sometime in the next 12 plus months. So you have a whole nother year to get past the pandemic. I would love for this to somehow lead to a live event where I get to meet many of you. Even though I've done live events for 22 years, and my own too, this would be rather special. Until that happens, we can meet in person at one of my courses. Even if you don't take my course, take a clinical, hands-on course. There's not many, by the way, with live patient training for you with, in my particular situation, is oral sedation, bone site development, atraumatic extractions, and surgical implant dentistry. Look into it. Let this be the year that we make a change. Enough of that. At my last podcast, I said to you, I gave you some examples of lots of gratuitous work that we do on a weekly basis for sure, and I would say multiple times a week. We've all experienced a crown that comes out on a patient, a crown you didn't do, a crown with maybe a speck of leathery decay, a crown that needs a new crown and a core, and the patient, it's just not the right time for them. They just don't have the money. And I'm sure a bevy of dentists on social media could argue with me that that's in my head and I shouldn't take that posture and whatever. That comes from one of my guiding principles, that if you really want a long-term successful practice, if you want the big nucleus that I so think that you need, this giant family of patients that aren't always engaged in coming to see you. So just picture this big cloud of your patients. Some of them always in that cloud come and see you. Another big section come semi-regularly. And many, who knows, they haven't been there so long, you don't even know if they still are patients of your practice. That cloud comes from, that giant nucleus comes from doing one thing every day that has nothing to do with anything except building relationships. That could be a phone call. That could be a letter that somebody, or a card. I get these daily that are on my desk. We make it a point to be involved as much as we can in where our patients are at in their lives, whether it's something they said to us, they have a surgery coming up, a surgery on a loved one, whether we hear it somehow through the wind, and sometimes it's too late. Sometimes the cards I send are sympathy cards, but sometimes it's a phone call. And I got to tell you, if you've never done this before on a regular basis, it's a good feeling. I know we all were taught, and I think it's a good policy, to follow up and call the patients after a surgery, after you pull a tooth, after you do a root canal, after you do anything that seemed like it was extensive. That is a good policy. I have my team do that, to be quite authentic with you. I don't make those calls and haven't for a long time. But I make these calls and I write these letters. And sometimes it's just about, did your daughter get into medical school? I know when you were in my office a month ago, that was a big thing coming up. Did it happen? You need to know that I don't reserve that just for my very finest inner crowd of super patients. It's spread out across the practice. In addition to that, there are multiple opportunities. I mean, I don't even have to look for them. Clinical opportunities to do something gratuitous and nice for a patient that has nothing to do with anything except relationship building, just like the other thing I just told you. So that's where re-cementing a crown and not charging them falls into that category. Adding a tooth to a partial that fell off. I mean, there's really a great deal, a great range of things we've done. Relining a denture. And you may say to yourself, what, is he crazy? Has he lost his mind? My practice was off 20% last year. And now Steve thinks that the way to fix that is do a number of services that we don't charge for. And you're right, that's what I think. I think that's how you build a giant practice of loyal people that would know that you're not the only thing you're interested in is a financial transaction on everything you do. Why can I say that? Because when you provide complete exams on all your patients, recall patients, new patients, and they may not be in the market for everything that you've recommended, but when you have promoted that, there is abundant work, abundant profit, abundant everything to fit in gratuitous work. And you know, many people have said this saying. I'm reading it from Maya Angelou, who I'm no expert on, who said, I've learned that people will forget what you said. They'll forget what you did, but they'll never forget how you made them feel. And I believe that philosophy belongs inside your dental practice. I do. So I brought that up at the end of the last podcast, and I wanted to elaborate on it. I want to take this opportunity because in the last two podcasts, I have been beating three cornerstones to you. And mainly I've focused on two of them, and that is creating this giant practice nucleus. And listen, you got to know why I say that to you. Because it saved me so many times in 2020. Just when I thought, because really it's true, the influx of new patients, particularly towards the last quarter, October, November, December, dropped significantly in my practice. And bam, out of nowhere, someone comes off the iCloud of my patients that I didn't expect, that I haven't seen sometimes in a couple years. And, you know how they've always said plant the seeds and all that stuff? I heard all that growing up 40 years ago. And I have to tell you, if you plant a seed in a patient's mind on the possibilities of improved oral health, maybe replacing missing teeth, maybe opening up their vertical, maybe improving a facet of their oral health that they have kind of put on the back burner and let go. And you do it always from a place of sincerity, caring, your heart, and not pushing it because you want to break 30,000 this month or 300,000 or whatever the number is. When you are somebody that is trustable and have earned that trust, it does come back to you. It absolutely does. I've experienced it too many times. And that's what I experienced in October, November, December. I wanted to write it down as it was happening to me because it's so affirmed the things I share with you weekly on the Lionhearted. So that's why I want you to have a practice, and the way to get the nucleus is just have this very mindful approach to patients that you're not selling them, This is what you really believe is best given their situation. And sometimes, by the way, it's not ideal dentistry because their situation is partly dictated by their budgets. It is. You can give me all the crocodile crap you want in the world that you didn't present it right. That's why no, sometimes people, especially in the world that we're in the middle of, with a pandemic and people have lost their jobs or just retired early. I mean, that's happened a lot. I'm sure it's happened to a lot of your patients. What is important is, okay, well then how does that translate out? Where do we draw the line with patients that can't afford all the care we want to give? And the answer, for me, I think a very solid answer is this. So let me begin. I am saying to you that my philosophy is rarely, sometimes it is, my way or the highway. Either you're going to do it this way or you're not going to do it all. Now, sometimes that indeed is true. For example, a patient that has periodontally compromised teeth. They don't have to go, but they're compromised. And they don't have any supporting posterior teeth, and they refuse that treatment. There are patients of mine that have premolar occlusion and no molars and have been that way for many, many years, and maybe on 3 and 4 month recalls, have a healthy periodontium, have a balance of equilibrated occlusion. Yes, but there's others that does not work that way. Or here's even a better example for you. A patient that truly needs some basic operative dentistry. It may just be one crown and a host of operative, restorative, direct filling procedures. But they have case 1 or 2 type perio. And we both know that many times that is asymptomatic. So it's hard for that patient who's not educated. That's part of your job. Remember Pankey said that? A great dentist, or he had a better word for it, I forget what the word he used to use, was an educator. And it's so true. This patient may not be educated from their prior dental experiences, and you know this is true, on the importance of a totally healthy periodontium. So that is a line in the sand for me for sure. I will not treat a patient. It's not okay to just crown the tooth. I guess you could extract the tooth. You could do that if it was in pain and not treat their perio. It seems to me that those days have long since passed because your practice really is going to become a reflection of what you are and what you lead. So if you're okay with looking the other way on early perio, or if you just treat emergencies, remember, if you go back to any of my early podcasts and hear me talk that dentists that preach that when the patient comes in with the chief complaint that you should fix that chief complaint and then reappoint them to come back to you, I do not believe in that philosophy at all. Because the problem is that's not how the world works. We have it hard enough in the dental profession because a lot of what we do is elective. I've said this for years. People can live without their teeth. People can even live with pathology in their mouth, asymptomatic as it may be. So obviously, let alone have the need to have a beautiful aesthetic mouth that may require full coverage laminates or, porcelain restorations. Even on the basic level, people can live without, as I just indicated. So, it makes the responsibility of you to be this educator. And that's a slippery slope a little bit because you don't want to become robotic when you do that. You need to work. You need to get in front of a camera if this is not a wheelhouse of strength for you. I'm serious. Look, what you do next week and the next month has everything to do with the patients you examine starting Monday in hygiene, new patients, and returning patients. And I can't beat that stone enough. Do you have a system in place right now for 2021 to increase the number or go after the patients if they're possible to return that have fallen out the back door. Recall. It's such a vital part of any practice. I'll hear my staff on the phone in my desk, which is across the hallway, say often, okay, let me do this. Let me just put you in the book for 3 months from now. If that date doesn't work out, we'll move it for you. I hear them say to patients out of state, which we have an abundant number of patients in my practice, who say, hey, when I get down there, I'll look at my calendar and I'll just call you. That's not what we do. I said that we find that never works. So it's better for you if we're just going to put you in 3 months from now. We know you might be in Florida. I'm in New Jersey, by the way. It's a 2.5-hour flight. And we know we probably have to change the appointment, but we do not want to not have you in the system. If they don't have any intention of coming back to us for whatever reason, so let's hear it and let them go. But if that's not the case, they're in our system. And if they fell out of our system, you better believe that I have a number of people with a number of different approaches we take to do recall. Recall is the backbone of any great practice. So back to the lines in the sand, meaning, what will I overlook? Well, I'll overlook replacing missing teeth. Sure, that is often not a part of phase 1 in my neck of the woods. It's not what I present. And that's a very hard thing to figure out with a patient. Like, we need to spend a significant amount of time in 2021, you and I, about the lines I'll use, the language I'll use, and when I'll use it to try to get information out of a patient. So, for example, let's think of a patient together right now who comes to you. I have one that came into me last week, a very significant case. It was one of these lucky cases. This woman does not like her smile. She has a fiance. This is the second time around for her, who's very doting. Okay, so think about that for a minute. This is all part of what you hear me talk about for the last 2 years. I have a lot going for me with this woman, this new patient. She comes into my practice. She brings her significant other. He wants to come. I am sure there's many significant others that say, go to your dentist visit with you? I don't think so. I'm out. Tell him to call me when he knows what the price is. Seriously, I don't run into that. It's very, very well handled by my new patient coordinator, who can explain the importance of the significant other coming to our practice. And there's really very logical reasons why. Now remember, I have the advantage that many of these patients are scared to death. And I've established a reputation that you could establish in your community, that we sedate patients, that I have a permit, unlike most other dentists in our area. And we can treat them in a conscious but very comfortable state of mind. It's unbelievable protocol that we use for oral sedation. So that's motivated this patient who may not have gone to any dentist for quite a long time. And this woman comes in and she needs basic crown and bridge, scaling and root planing, but minimal bone loss, less than 10%. But we're pretty much doing premolar to premolar, and most of the molars are gone. And that would be a phase 2 in my practice. And this was a big case. But adding molar implant dentistry to her mouth would have increased the treatment plan by almost 80%. It was clear that they were willing to invest in her mouth, but there was limits to what they could do. One of my lines in the sand is I don't feel compelled to replace all missing teeth. In fact, I wouldn't even recommend, if they're missing a single molar and it's been gone for years, and you can tell, teeth have drifted a little bit, absence of bone on the buccal aspect of the tooth, and it's not an issue to them. My approach, my recommendation to you would be, and one of the things I look at, because it is the missing teeth on my patient, and is that a factor or not a factor on anything? And you're only missing one tooth. How does that for you? I'll ask them something like that. I'm serious. This may sound sacrilegious to some of you. I call it real world dentistry. I think the worst thing many of you could do, that patient had no other needs, maybe I'd bring it up. It would depend on how important it was to them. But lines in the sand that I would not overlook: a refusal to treat their periodontal needs, whatever I thought they needed. A refusal to treat active PA pathology. So what I mean when I say that is, we both know that sometimes we see scars or areas that have had endo and there's a periapical radiolucency that's kind of small, asymptomatic. No, I'm not going to necessitate in phase 1 that they retreat an endo. If they needed a crown on the tooth, and there are times where I do include that in phase 1, and I do include them to retreat the endo. But mostly with me, it's perio. Mostly with me, it'd be a refusal to deal with obviously clinically active disease. And whenever I can segment treatment, I certainly try to segment treatment with my patients. A phase 1, a phase 2. So the takeaway from what you're hearing me say is, when you go into the operatory, you want to promote this proactive education from you to a patient who could be healthier. And this sense that, and shouldn't that be true? That we are in this with you for the long run. Isn't that your goal? I mean, I'm in this 40 years and I meet new patients still. And that's how I talk. I say, listen, I want to be your last dentist. And I don't know what they're thinking. I don't know if they're thinking, well, I may be your last patient because you look kind of old. I don't know. But I do say on the serious side that I am committed to taking their mouth from whatever condition it is on this day and making it healthier, unless it's already amazing. And not getting to a place one day where we have our denture is our option. Now we're talking about a full removable prostheses. And by the way, backing up, I got to tell you something. You hear me talk as if it's very common, because it is, that my patients commit to a 3 and 4 month recall in my practice. It's a big part of my practice. It should be a big part of your practice, because most patients are not compliant. So, very few patients floss. So that's why it's a big part of our practice. I make it clear to every patient that gets scaled and root plane. That's what I say to them. I say, let me tell you something. What this means also is that you're going to be coming back here every 4 months, and in some cases 3 months. And that time period is going to come around so quick, you're going to not believe it. Your instinct, it will be to maybe blow it off. And you're wasting your time getting anything done if you're not going to commit. I'm telling you, I've been doing this 40 years. That is the biggest Achilles heel of a patient that goes through periodontal treatment, that they, for lack of a better word, fall off the wagon. I don't want you to fall off the wagon. I want to push you, not because I need you to come in for the business. I'll talk like that. I need you to come in because the literature is crystal clear and my history is crystal clear that I can maintain your teeth with least complications if we maintain you every 3 to 4 months. And by the way, your insurance isn't going to cover any of that part of it. And that's the kind of talk that goes on. Other patients might not be anything other than ambassadors of goodwill from this approach I'm giving you. They just never commit. They might even go to another dentist. My sense is that not all of them. I'm sure I have patients, no matter what I've said to you in all these podcasts, that think I'm trying to get in their pocketbook. I couldn't be any clearer that that is not what I'm trying to do with these patients, because it's not what I'm trying to do, and it should not even be in your head. I know most of you who listen to this kind of podcast that it's not your factor, but I'm unabashed about talking about it. You've heard me say recently that I love saying that to a patient. I love saying, I'm not here to sell you anything. Just like that. I'm hoping to want what I recommend, based on what I'm saying to you today. If we can fit it in your world, because that's always, the bottom line. And maybe there's creative ways out there to convince patients that they should fit it into their budget and all that. That is not where I want to go. There may have been a time in my career where I didn't think like that, but that's how I think now. I don't want to talk them into something. And there are many patients that qualify financially through Care Credit, Lending Club, Green Sky, but they're not comfortable with the monthly payment that the financing cost. So they don't do it. Just let me leave you with this. This is what we need to do. Even though I've provided more podcasts on case presentation than any other subject I've talked about, because it is the most important. It's the number one factor, obviously, that dictates what you're going to do next week. Of course it is. I got to tell you, most of my year is spent having trouble finding a space for the next patient that commits because I'm consistent. I'm talking to patients with earnest, just like most of you. Maybe you talk with earnest, but you're not skillful enough at it. So maybe it doesn't come off as authentic as it can. That's why we need to work on this. You need to write to me. You need to tell me where you need help. I'm beginning to create a product where I'm taping all of my new patient interviews. And I'll have little stories, and I'll put it in a form that you can listen to it. And there will be price for it, trust me. I think it's the biggest step that you can take in 2021 to changing your whole practice. Because once patients say yes, everything else becomes easier in your practice. The cash flow improves. You can afford more CE, and everything fulfills the next domino towards an enduring, successful practice. You're less pressure. When you have less pressure, you're a better leader. When you have less pressure, your memory is clearer, and you can think of things. You're not cluttered with, oh my God, how am I going to make payroll? So anyway, the purpose of today's podcast was to tell you that there are lines in the sand when they can't choose comprehensive, complete dentistry. And your job is to work on what is a responsible treatment plan that you can live with. And in all my treatment plans, the soft tissue is not a bargaining chip. Hope this helped you guys. I appreciate you more than you know, and I look forward to the day we can meet in person. Have a great week. See you next week on the Lionhearted.